Good afternoon to all. Today's remedy is Anthracinum. Common name becoming anthrax poison. Name speaks for itself. It's a no-soap. The source of Anthracinum remedy is prepared from the spleens of affected sheep. Please remember the source because you can also remember a symptom of anthrax by this exact source. You have epidemic splenic diseases of cattle, horses and sheep that we will come across in the upcoming slides. Speaking of nosodes, we have noso, a term that comes from Greek language, and noxa, a term coming from Latin language, which both of which are related to the word nosode. Term is coming from here. Okay. Nosode classification, we have four. This type of classification on the basis of material used for the preparation of nosode, you have four classification. We have another classification which I am not bringing here. But yeah, so N1 to N4 you have bacterial endotoxin. The example is typhoidinum, bacillinum. If the source is a microorganism capable of producing exotoxin, just like that of anthracinum and diphtherinum. N3 is coming from purified toxin, and N4 is from organisms or viruses, clinical materials from diseased subjects, like that of Sorinum or variolinum. Sorinum is scabies and variolinum is smallpox. Okay, I just want to give a little credit to Dr. Mansoor Ali sir for at this moment, because I was not having this nosode classification in my hand. This is not a paid promotion. I don't get one single penny from him, and this is from my personal suggestion. If somebody doesn't know about his site, I just want you to make you aware about Homeobook. Okay, Homeobook is the website of Dr. Mansoor Ali sir. He's from Kerala. I need not introduce to you people. I think you will be already knowing that. But if there is one person who doesn't know about him, I just want you, because academic point of view, the information given in Homeobook is excellent. You have free access to whatever, almost everything that is related to UG, PG teaching. It's there. Okay, so whenever you have some kind of doubts and I can vouch Homeobook for that authenticity of information, because they have a lot of references and authentic references. That's why I'm taking his name. This is a humble suggestion from my side. There is no compulsion from any angle. Okay, so this is a humble suggestion from my side. Whoever doesn't know about Homeobook, please go and see. If you find it useful, please let me know. Okay, I found it useful. That's why I'm saying this. Okay, again I'm saying this is not a paid promotion. I hope he doesn't know about me. I'm saying this is a very valuable asset in the academic point of view. You have a lot of information in this website. Okay, yeah, going ahead. Okay, physical genitals, you have hemorrhage. Again, the hemorrhage is described as blood oozes from the mouth, nose, anus, or sexual organs. How is the hemorrhage? Black, thick, tar-like, and rapidly decomposing. Okay, just like that of Crotalus horridus. So wherever you get hemorrhage, I think Ophidia comes here. And when you think of a decomposing type, there is some kind of hemolysis going on. So Crotalus horridus is something that you have to remember in such hemorrhages. Septic inflammations from absorption of pus or other deleterious substances with burning pain and great prostration. Now, sepsis, three important remedies you have to remember. R-salve in general, pyrogen, very important, and then you have anthracite. Okay, everything have its own characteristic features, but on the whole, sepsis, these three should be there in your mind. Even to an extent, carbolic acid or carboanimalus can happen. But then, please, these three are the remedies that you have to remember. Okay, arsenic, pyrogen, and anthracite. Bad effects of inhaling foul odor of putrid fever or dissecting wound poisoning by foul breath. Okay. Okay. Again, I'll just say my interpretation. I cannot say that that's true because I don't know what they thought about this thing. This is my way of interpretation. Anthracinum, I've not seen much clinically given for any kind of droplet infection, but why I'm saying is inhaling foul odor of putrid fever. Okay, maybe it's exactly what it meant. You smell something foul and you come up with some disease. I can understand that, but if you think else, in some other angle, putrid fevers are usually infectious, let alone all your other causes of fever. Think of infectious fevers, and infectious fevers, lot of infections are droplet based. So droplet infections, you inhale foul odor. If it's not exactly speaking of the smell of the odor, if they mean the organism is foul, then you can think of a droplet infection. Okay, this is my way of thinking. It need not be exactly a very stinking smell coming from some fever. Okay, this is my way of understanding. If it's getting confused, please keep it aside. Okay, so I think like this. Okay, fine. So bad effects from inhaling foul odor of putrid fever or dissecting wound poisoning by foul breath. You again have pyrogen on the brackets. Okay, epidemic spleen diseases of cattle, horses, and sheep. Okay, here you have your black Usher that is already shown here. So that being said, you have to know a little on clinical aspect of anthrax. So I thought I'll put a little on anthrax here. It's an endemic zoonosis. So what is endemic? It's going to be confined in some particular geographical area. That's what you say of an endemic disease. And zoonosis, yeah, it's going to come from an animal. Okay, it can come from animal to animal, animal to human. Okay, and then you have a lot of various types of zoonosis which you will be dealing in PSM. First bacterial pathogen to be isolated by Coates, who is again regarded as father of bacteriology. You have three types of anthrax: cutaneous, gastrointestinal, and inhalation. Please again now correlate your foul odor, bad effects of breathing, foul odor from putrid inhalational. Okay, please remember that. So you have a inhalational anthrax also. Cutaneous, yes, definitely your black Usher is coming here. It's a gram-positive bacilli, spore-forming one, exactly. Papule. Papule means a raised, skin lesion. Macule is almost flat. Papule. Papule with hemorrhagic base and an edema, and you have a pathognomic black Usher. Pain is less marked, very unlikely of anthracinum. Anthrax has less pain, but anthracinum has burning, intolerable pains. Okay. Erysipelas, which again is another condition coming up in anthracinum. Why erysipelas is mentioned here, I want you to remember, because it's another important question from a surgery point of view. That erysipelas and cellulitis, they always confuse. So erysipelas has well-defined margins, unlike that of cellulitis. Felon, it's a bacterial infection of the pulp of the finger. Okay, pulp of the finger. Okay, great. Now, yes, exactly. Felon, the worst cases with sloughing and terrible burning pain. You have arsenic, album, carbolic acid, and laxatives. Okay. Yeah. Septic fever, rapid loss of strength, sinking pulse, delirium, and fainting. Okay. So again, septic fever, pyrogen comes. We know that. In skin, you have carbuncle, you have ulceration, intolerable burning, sloughing. These three words always related to anthracinum. Dissecting wounds, especially if there is a tendency to become gangrenous. Okay, so see how the pathology goes. You have a felon, you have sloughing there, then it goes a little more beyond. Okay, it goes to become a gangrene. Okay, it goes to ulceration, then you go for gangrene, and now gangrenous ulcer definitely if gangrene is there, there is no question of evidence of your bacteria. It will be there, and once bacteria is there, that causes septic fevers, and whole pathology of anthracinum comes there. Okay, so please remember the aggressiveness of anthracinum. The following symptom is that only. Malignant pustules of black or blue blisters, often fatal in 24 to 48 hours. Okay. Again, another remedy coming up here is lachesis and pyrogen. So pyrogen is going to come in almost every this thing. This I think the livid characters, the black, blue, your all those stasis, all those features can be brought from a lachesis point of view. Burning is there. Even lachesis have varicose issues. So varicose ulcers, again a gangrene can form there. So if you want to relate like that, you can think. Okay, carbuncle with horrible burning pains. So again, burning is coming up here. Discharge of Icarus offensive pus. Again, not a very big thing because once bacteria is there, you're going to see foul discharges. Yeah, so this is the gangrene. You can see a clear line of demarcation. Mostly it should be, the photo depicts mostly like that of a arterial ulcer. Okay, gangrene, arterial gangrene. Skin, you have suspicious insect stings if the swelling changes colors and the red streaks from the wound map out the course of lymphatics, lachesis and pyrogen coming up again. So insect stings, you always have to remember anthracinum as well, just like that of your lead and pal, or you have your caladium, all those things. Okay, and another important quote that you have to remember about your skin is, from a author point of view, is that Herring says to call a carbuncle a surgical disease is the greatest absurdity. An incision is always injurious and often fatal. The case has been never lost under the right kind of treatment and should be always treated by internal medicine only. So, mean to say that it's not a surgical disease. Carbuncle is not a surgical disease. You have to treat it by internal medicine. A very important quote from a PGT point of view. From Boric, you have 2 points that you have to remember, which both we have already discussed, I guess. Bad effects of inhaling foul odor, succession of boils. You have a lot of remedies of boils. Okay, so let's compare a little. Arnica, you have one after other. Okay, one after other boils coming up with intense soreness. Sulfur, you have suppuration and small boils in crops. Okay, small boils in crops. Silesia, you have ailments from vaccination, another suppurator remedy. Felons, boils, suppuration, ailments from vaccines. Cicale, you have green contents, green pus, okay, green contents, and mature and heal slowly. Another one, tuberculum, again green contents, okay, green fitted pus with intense pain where the location is on nose. Tuberculum, nose. Again, please remember, tuberculum, something comes with cold, coryza and also nose, respiratory, nose. Okay, so that's it. Relations: when arsenic or the best selected remedy fails to relieve the burning pain of carbuncle or a malignant ulceration, you have to think of anthracinum. So if arsenic fails, you have to think of anthracinum. Okay, all the other similar remedies were already compared. So to say about this last point, in a cancer or carbuncle or erysipelas with terrible pains, you initially prescribed an R-salve or anthracinum, but it failed to improve, then you have to think of Euphorbinum officinarum. Okay, so that is the remedy here. The questions: septic fevers, especially puerperal, demonstrate great value. Okay, the answer is pretty straightforward. It is pyrogen because there is homeopathic dynamic antiseptic mentioned here, and that is pyrogenum. You have skin scale dry scaly, cold blue, wrinkled with cold, clammy perspiration, parchment, white paste. It's going to be R-salve. Okay, black vesicle and burning pains. Okay, it's R-salve, and that's the end of it. Okay, thank you.